Hello everybody. Today we're going to deal with the PHTLS Refresher 2020. We've already dealt with X in regards to hemorrhage and bleeding, so this time we're going to deal with Airway, how to effectively manage the airway in the trauma patient. So we're going to understand the importance of the new PHTLS primary assessment. We're also going to fix some of the life threats as they are found. Like we discussed previously, we already talked about X in regards to hemorrhage. This will focus on the airway. So is the airway patent? And what is the best way to secure the airway in this patient? As we move down through breathing, circulation, disability, and exposure, we're going to also review when to stop your assessment during your primary assessment. So let's review some of the techniques for correcting airway issues, and we're going to give a broad overview. In regards to BLS, simple airway maneuvers with spinal mobilization there. Remember the jaw thrust is effective for opening the airway. The OPA or the MPA as chosen or as is necessary to secure the airway. And we also had the bag valve mask we use with O2. In regards to ALS, we're looking at endotracheal intubation. Does the patient require facilitated intubation? And what are the correct doses that we're going to use in regards to both the adult and the pediatric? We also have the King airway, and we have the surgical or the needle cricothyrotomy. In regards to when we're doing the intubation for paramedics, it's extremely important to understand that the only time that we're going to hyperventilate the patient is when they start to show signs of active herniation. It could be like a change in their level of consciousness. It could be unequal pupils that develop. It could be posturing or even some of the Cushing's effect. But for the most part, we want to continue with ventilations with a end-tidal CO2 between 35 to 45, but only when we show active signs of herniation do we start to hyperventilate. So we're securing an airway, and we're also monitoring the patient in anticipation that we have to hyperventilate them there. Even though we do have the King airway and we have the surgical or needle cricothyrotomy, don't think as the needle or the surgical cric as your option of last resort. You may come on the scene and find the trauma patient where that is your only option in order to secure an adequate airway. So some of the goals of trauma care that we're going to review are as ensure patient and responder safety. Identify and treat immediately life-threatening conditions, which could be bleeding, airway obstruction, and attention pneumothorax. Assessment, identify and stabilize primary and your secondary injuries, and transport to the closest, most appropriate facility based on the patient's condition as quickly as possible, maintaining an on-scene time of less than 10 minutes.
Whoa, dude, are you okay? You alright, bro? I'm here at Indian Rocks Beach Skate Park. It says on the building 1507. I can't see the name of the street, but my telephone. So I have a guy over here. He was skateboarding and he fell pretty hard on his neck. It looked like he might have knocked himself unconscious, and yeah, he's unconscious now.
Fire attack, Bravo, truck 27, unconscious person, Indian Rocks Beach Skate Park, grid 384B, truck 27, fire attack, Bravo.
Hey buddy, what's going on? Buddy, you here? He's unresponsive, guys.
Understood, 27, from 460, going up.
Anywhere? No major bleeding? I guess he's fine. Alright, let's go ahead and roll him to the backboard. Got a collar. You want to call a trauma alert? Yes, trauma alert. He's unresponsive.
What do you estimate him to be, Travis? How old?
About 15 years old. I don't guess anybody been able to get a hold of a mom or nobody here.
One red.
Relax. Get the ball on there. Ready? Hot ground. Let's get him off the ground. Back's clear.
Okay, it's clear. Ready?
One,
2, 3. I need to slide that board over just a slip.
Bundy, why don't you go
got
ahead
the
and
head.
assess the airway while you're sitting
down.
there, okay, buddy?
Your head count? Adjust him?
Run, come towards me, please.
What did you see on his neck? Anything right on
Looks like we have Pretty good contusion over here to the right hand side. Got some real, got some swelling going on right here.
Yeah, that strider seems like it's getting a little bit louder, doesn't it?
If you want, get him on a monitor. We've got the end title in there and get a blood pressure. The stethoscope in there for you.
Working now, sir.
You got the BBM. It's in the kit.
There you go, Rick. It's in the kit. All right.
Yeah,
pressure's
he's definitely
working.
Strider.
Blood pressure's
I
working.
was thinking he looks more like 60 kilograms.
Okay.
Let's see if he's got a gag reflex.
Okay, here's your OPA, Rick. I'm getting your BBM for you. Fundy, when you get a chance, I need
You want
a,
trade places with me if you want.
a BBM entitle.
Coming up, sir.
Thank you,
See
sir.
if he's got a gag. Yep, he's got a gag reflex. So
All
I'm
right, so we're
thinking.
gonna have to tube him.
Yeah, so I'm thinking he's probably about 60 kilograms. If you want to bag him
Okay.
for now, he's about at 2 mics per kilogram. That's going to give us 120 micrograms of fentanyl.
Okay.
And then at the etomidate is going to be 0.3 milligrams per kilogram. That's going to be 18 milligrams, which would be 9 mLs.
Sounds good, Rick. Let's do that.
There's your capnography, sir.
Capno's good. All right.
If you want, once you get that set up, I'll start getting some stuff out and draw up some medications, and then I'll take over BBMing.
Okay.
Can you get an IV, please?
Blood pressure's
Okay.
a little bit elevated, guys.
Hey, Fundy, can you go ahead and bag? I'm gonna get an IV started.
Yes, sir.
There you go.
That's all. So when I intubate, I'm going to ask you, then hand me this end title, okay?
Yes, sir.
All right, we ready?
All right, we're good to
We
go.
need a bag of fluid hanging.
Okay.
Hang tight. BBM. Give me a bag of fluid, I'll go ahead and intubate. 7.5.
Fundy, why don't you
End title? Okay, please bag him.
want some lung
I got
sounds?
missing a tube, we'll get some lung sounds. How's your end title? Looks like about 60. Okay, tube is good.
Breathe. Good, we're positive. All right, we got good lung
Good
sounds.
lung sounds? Okay,
we're
let's
good.
secure the tube and then let's get out of here.
All right, I'm gonna get. All right, hey Fundy, go ahead and I'm gonna get this bag hung. We're gonna go ahead and do another secondary assessment once you guys get that knocked out. Okay?
Roger.
If you want to. Let's secure the tube.
I'll hold it.
Thank you guys. So we got good bag compliance.
Yes.
Good end title. How's your lung sounds? We're
Your
good.
lung sounds are clear.
Okay, no epigastric.
Yep.
How's
And
your
equal chest
an
rise.
equal chest rise and fall. Okay.
Yes, sir.
All right,
Alright,
I'll
I'm-
take this.
I'm gonna go ahead and start another secondary assessment. All right, Rick.
All right.
Looking, we got equal reactive pupils. All right, looks like our edema is getting a little bit worse here on the neck, but we got our airway started. Clavicles intact. All right, equal chest rise and fall, good. Abdomen is soft, non-tender still. Still intact. Moving down at our legs. There's positive pedal pulses.
Good.
Coming down still. Good positive pedal pulse there also.
Now we need to call the hospital.
All right, our line is still good. Good, we have good radial pulses, they're matching.
Got a
We
radio?
should be
Let's
there
call
soon,
report.
guys.
Let's call report.
Okay. Engine 27 to all children's.
There's no children, go ahead.
Copy engine 27 en route to your location about 15 minutes out with a 15-year-old male. Patient has a advanced airway place secondary to a fall on a skateboard ramp. Vital signs are as follows. Blood pressure is 110/60. Heart rate is 120. End tidal is going to be 35 at this time with an oxygen saturation of 98%. Like I said, we are assisting ventilations and we're 15 minutes out.
Can you get us another blood pressure, please?
Blood pressure working. Coming up.
Okay, just to copy, you guys do have innovation.
Copy, patient is intubated.
Copy, we'll see you when you get here.
So the EMS providers are getting the information from the caller who's on the scene. Once the vehicle arrives on scene and the providers jump out, as they approach the patient, they start their scene assessment with their initial observations. Once they make contact with the patient there and they start to do their primary assessment, they quickly declare a trauma alert, knowing that the patient meets the criteria just based on the information they've received so far and what they've gotten from their assessment. What's not shown in the video is that as the guy was skateboarding, when he slipped and fell, he hit his neck on the side of the bar there. After they do the packaging and they place him on the backboard, they transport him to the unit there. They start to notice the respiratory distress that he's having, which is indicated in the video by some of the stridor. That's when they start their facilitated intubation on the patient. What's important to recall is that they've also done the IMAC as well. It was discussed back and forth between them on the dosages and the correct and proper treatment for the patient that was going to go forward there. Their secondary assessment is conducted after they've gotten in the unit and they start doing their transport, so to speak, and their on-scene time was less than 10 minutes, and most appropriately, they transport to an appropriate trauma center at the end.